Okay, good morning everyone, and thank you very much for coming along to this public session of the annual review of NHS Health Scotland. My name's Jamie Hepburn, MSP. I'm the Minister for Sport, Health Improvement and Mental Health. I'll be chairing this session. You're all very welcome. Margaret Burns is the Chair of NHS Health Scotland. She'll be undertaking a presentation in just a few moments. She's joined by a range of her executive team. I'll let Margaret introduce the top table in just a session. I should mention that this is Margaret's final annual review, as she's due to step down as chair in November, so we couldn't let that go unremarked. These annual reviews provide an opportunity for NHS boards to highlight their achievements over the previous year. They're also part of the process of holding boards to account for the expenditure, large sums of taxpayers' money that is invested in NHS Scotland. We've listened to feedback from the public, who have called for a more focused public discussion of the key issues ahead of the opportunity to ask questions. So, as such, the review is in two sessions. During the public session, as I mentioned, Margaret will give a short presentation on the work of Health Scotland, with a particular emphasis on key achievements and challenges in delivering a fairer, healthier Scotland, NHS Health Scotland's strategy. And after that, there will be the opportunity to ask questions. You just indicate that you want to ask a question, and there will be a microphone provided. I'm reliably informed, I don't know who's the microphone's at the back, so we've got a microphone, so we're okay. And then the second session of the review, it will be in private between myself and the full NHS board. This will be a more detailed discussion of local performance and the follow-up letter which will be sent from me following today's review. So, without further ado, can I introduce you, Margaret?
Right, I'll just stand up so that everybody at the back can see me as well. And on behalf of NHS Health Scotland, I'd like to welcome you here today, and thank you for coming on a day for which the word dreich was definitely invented. So thank you for that. I'll start by introducing the executive team at Health Scotland. So from me to the left, we've got Jerry McLaughlin, who's our Chief Executive, Kath Denham, our Director of Strategy, George Dodds, our Director of Health Equity, and Andrew Fraser, who's our Director of Public Health Science. And they're going to be here to help answer any questions that you might have. And I hope you do have questions for us. As the Minister said, the annual review is our chance to account in public for how we've done in year and how we see the coming year. But right at the start, I'd just like to start with saying a wee bit about who we are, just for everybody in the room. We're the national agency with a remit to tackle health inequalities and improve health. We do that by looking for more equitable and better practice, improved policy, and also stronger support for action around about health inequalities and health improvement. Now, you'll all have in your pack the briefing about health inequalities, so I'm not going to go into that. But I think it pays for us just at the start, because I'm very aware of what we're going to be talking about. It's going to often does sound a wee bit corporate, a bit about management, about planning, about outcomes. But at the heart of it, what actually drives us in Health Scotland is about making a difference to people's lives in Scotland, particularly people who suffer from the most disadvantages. And we all know that in the past few years, things have got a lot harder for people in Scotland. So I want to assure you, Minister, in this audience, that at the heart of it is what drives the Board of Health Scotland, and it's what drives staff in Health Scotland. So, to the meat of what we're doing, it's very hard to give an overview of what we do because we've got a big vision and we've got a big agenda here. There's a number of parts to the annual review. We've got a detailed self-assessment. You'll have in your packs the at a glance of how we did. The Minister today's had the chance to see in more detail areas of work in physical activity and mental health and tobacco control. There's been some examples in the marketplace there, but that's still only some of what we do. I'm not planning on repeating anything that you're able to read, but I'll just try and pick out what the key themes are and the key highlights. And the first thing I'd like to say, the key theme is that Health Scotland performed well. We delivered everything that we said we would in our annual delivery plan, which we agree with Scottish Government every year. including meeting all of our financial targets. In particular, our efficiency savings target of something more than £1 million. We've made good progress in all of the key areas that were identified in our last annual review. And I'd like to pick out just some highlights of that, particularly around about communications and engagement, building support for action. We had a 50% increase in engagement with stakeholders, particularly some of the tailored inequalities briefing that I know that some of you in the room have seen and have welcomed. We've had something 70% of the people using our products and services speak very highly of them, so we're really doing well in that area. But I think it's also true to say that there's some areas we would have liked to have done better, particularly in our work with the NHS and with local partnerships. We have made progress, but we'd like to have done more. So, for example, the work we do with local partnerships, now we've been working with lots of local partnerships, health and social care partnerships, community planning partnerships in different bits of Scotland, and they've been going well, giving them help in understanding health inequalities planning. We're working with the National Improvement Service to come up with national resources for local partnerships. And we believe this is the right approach. It's very much about collaborative working. This is how we work, is working collaboratively. But that takes time and it takes resources. So we'd like to do better on that front. We'd like to do more, and we'd like to do that better. We've continued to make improvements in our role as an employer. Our staff are our main asset. And the Minister's I've seen some of our excellent staff this morning, and I know that many of you in the room will know how good our staff are. We want to be a good employer. Our annual staff survey results this year were really good. We saw improvement across a range of areas, but we want to do better. And I'm absolutely delighted to say we won our Healthy Working Lives Gold Award this year, and that's just excellent. We've also made good progress on implementing our corporate strategy, A Fairer, Healthier Scotland, which I hope you've all seen, and I'd like to really focus in on that. We set this out in 2012. It's a 5-year strategy. We're 3 to 4 years in. How are we doing with that? And I think we in the board, we think we have been making good progress there. There's a few things, it's made a big difference to us. It's been incredibly significant to the work that we do. The first thing I'd like to say about that is that we are interested in tackling health inequalities and improving health. We are interested in both. It is not either or. We know we can't just focus in on improving average population health, because if we do that, there's a good chance we won't do anything for health inequalities. In fact, we might actually make them worse. But nor are we interested in tackling health inequalities at the expense of any particular group. We want to improve the health of everyone in Scotland, but do that in an equitable way. So that means improving the health of the folk with most disadvantages more quickly than people who have more advantages. We want to see a Scotland that's fairer and healthier, and the two are linked. And that's why, Minister, we've been really glad to see the two big conversations the government's presently having with people in Scotland about a fairer Scotland and a healthier Scotland, and we are very keen to see how we can contribute to both these big conversations. The second point I'd like to make about that is what probably everybody in this room knows, that health inequalities don't sit on their own. They're linked to other inequalities, particularly around about power and resources. And what that has led us to is work that actually looks at tackling these fundamental other inequalities. And for example, in year we published reports looking at preventative interventions. And they make it clear that actually interventions that look at some of economic inequalities and environmental and social circumstances are really cost effective in achieving health outcomes. And they're likely to be more effective in tackling health inequalities than just treating the ill health that turns up at the NHS. So these reports give some ideas of the interventions that are likely to be most cost effective, and I know that's a report that has been very welcomed by parliamentarians and others as well. Another example of the work that we've been doing is with the NHS, and that's about making sure that workers in the NHS can identify when a patient or their family have got financial issues and know how to get them the help that they need. So that's an example of how we're looking at these more fundamental inequalities as well. The other thing I'd like to say about A Fairer, Healthier Scotland is it's been a challenge for the board. As you said, Minister, our job in this annual review is part of it. Our job as a board is to assure the Minister and the public that we are spending the money we get well. Now, we're really clear that that means that we deliver what we say we deliver, we do it well, we do it economically, and we do it efficiently. But beyond that, we need to be sure that we're actually making a difference, that what we're doing is effective. Now, that's a challenge for us because we're interested in these quite often long-term outcomes. We want to change health outcomes, health inequalities outcomes. These are sometimes long-term. As I said, we work collaboratively. That's part of the DNA of this organisation. So how do we measure our part of that? How good are we at collaborative working, and what's been our contribution here? And the other thing I'd like to say is that we're interested in I said at the start, we want to see change. If we're going to actually reduce health inequalities, we need to see change in a whole range of different settings, different organisations. And everybody here knows that's difficult. And it certainly takes more than just issuing guidance or information, although you might need that at the start. So we are doing work that is about supporting people, encouraging people, influencing people to change. And that's a challenge. Well, how do we measure that? How are we sure we're doing that well and that we're actually going to achieve outcomes at the end? The board has worked very hard at that, about showing that we are making an impact. It starts with planning. You need to be sure that what you're planning to do is likely to impact on outcomes. And then you need to have measures, short-term, medium-term, to measure that. And I'm very pleased to see our delivery plan for this year does just that. It's not just a list of what we're going to do. It's actually saying how they will impact on outcomes, and then the ways in which we'll measure whether we're going to be successful. So that's very important work as well. It's a bit corporate, but it's fundamentally important to making sure you're making a difference. So looking to the future in terms of challenges, well, demonstrating impact is a continuing challenge that we're working. We're working with stakeholders to what are the performance indicators that they think will show that we're making a difference. I also need to mention the money, Minister. Over the past 5 years, we've had efficiency savings about £1 million per year, and we've managed that of a budget at the start of about 24 million. Now, we've managed those, and we will manage our efficiency savings for this year. But the board's pretty clear that that's probably at the limit of what we can achieve in terms of efficiency savings, doing things more efficiently. Afterwards, after this, I think we're going to have some difficult conversations, but I think important conversations about what it is really important that we keep doing and what is perhaps less important. I think looking to the future, one of the big things that happened in year was that ministers announced a public health review. We very much welcome that. We think it's a great opportunity to look at the public health system as a whole, to make it more efficient, more effective, sustainable in the long term. We helped support the review through the Public Health Observatory so that they could get a wide range of views. They're not due to report till later in the summer. And as we know, the summer is one of these flexible terms. But the reviews that have been coming to the review so far, I've been really pleased to see there's quite a lot of support throughout Scotland for what we think is important. We think it's important that there's an overarching strategy for public health in Scotland, and one that puts health inequalities at the centre of it. And there's a lot of strong support for that. There's also very strong support about the need for a strong national resource to do work nationally, but also to support local delivery. So we are looking forward to seeing the results of the public health review and how that can take us all forward to a more efficient and effective and sustainable public health review. In terms of what we think we need to do better, well, the improvement areas we identified at our last annual review, which was only 9 months ago, we think they are still the ones where we still need to improve. They still stand. And we will continue to work to improve them. And I can assure you, Minister, that we're absolutely confident that we will continue to perform well and that we will continue to make a difference. Okay.
Thank you very much, Margaret. I was very remiss, ladies and gentlemen, not introducing Donald Henderson, the Deputy Director for Public Health, who's here with me from the Scottish Government. Can I invite questions from you, ladies and gentlemen, for Margaret and the rest of the panel? here today. We have apparently some questions been sent in by Twitter, but I will try and prioritise questions from the floor, seeing as you made the effort to be here. And asking, there is a microphone, as I mentioned, which just indicating we'll get that sent to you. And asking a question, if you're comfortable doing so, please introduce yourself, or there's no absolute requirement to do so. So who would like to ask the first question? Just the microphone will just be 2 seconds.
Yeah, Ian Tasker, Assistant Secretary with the STUC. It's in relation to tackling health inequalities, and clearly we've welcomed the work that the Scottish Government have done in relation to the Fair Work Convention, and we do see there's a link between the Fair Work Convention and developing good work in Scotland. What we need to look at is how trade unions can play a part in that. It's an area where we've, for one reason or another, tended not to go into, although we've paid more attention to occupational health in recent years. But I think, and I notice that there has been comments in there in relation to the way the report is presented, and I think that's important to us as well, that information that comes out from NHS 24 is presented in a way that non-health professionals can understand. But clearly we would be wanting to do anything that we can do to assist in delivering and tackling health inequalities, but we also have, I'm interested in the views of how you see additional powers in relation to particularly welfare reform actually being used to challenge health inequalities, and potentially other additional powers in the future more directly related to providing good employment being used to tackle health inequalities.
Okay, Margaret.
Well, I'll just start off to say that's really welcome, because I do think there is an absolute alignment with the trade union movement in terms of tackling health inequalities, and clearly we have a shared interest in the of promoting good work, because we know that good work promotes health. And that's a bit of a technical term, good work. It means things like that you get a living wage, you have some control over your work, and there's a range of things that sits underneath that. And that's certainly where we would very much welcome the offer that Ian's made, and we'll certainly work with him. In terms of the new powers, Jerry, if you want to.
So maybe if I can just track back a second, Ian, I know that you're very familiar with the work we do around healthy working lives, and we've extended some of that work and used the expertise from that team to really start to inform our own position in terms of the evidence of what not only good work does, but what fair work does. So 2 particular pieces of work to look out for. First of all, within a national grouping called the Inequalities Action Group, we've tried to take the work that was done under the Ministerial Task Force on Health Inequalities and move that beyond where we were before in terms of trying to understand the evidence of what makes a difference. And the very first paper, which will be considered by that group tomorrow, is on income and welfare, and I think that's something that I sense that STUC will be very interested in seeing what the evidence tells us around about that. There's been reference made to the inequalities briefings and the series of briefings that we have recently started publishing. The next one is a briefing on good work. So again, I think that might help. I think there are some limitations about what we would want to say in terms of the use of the new powers. I think that might be for the government to determine how we would do that. But the government, I think, will use as one of their important sources of evidence about what the evidence says could be done. And I guess just one note of caution, because we have powers doesn't necessarily mean that we always use them. I think the important thing is to just try and tie our actions around what feasibly will make a difference to reduce inequalities. Certainly within the work setting, 2 last thoughts from a Health Scotland point of view. We've invested an enormous amount of effort with our own workforce. We've got a particular form, as you know, of engagement within the NHS around partnership working, but indeed our main recognised trade union within Health Scotland is Unison, who have indeed entitled one of their own strategy documents, A Fairer, Healthier Scotland, and it seems to me there's quite a convergence of interest in terms of what the outcomes that we are looking for, and I don't think they're very different to the ones that the Minister is probably looking for.
Okay. Thank you, Jerry. Any other questions, ladies and gentlemen? It's good the microphone doesn't have far to go there.
Hi there, my name's Elaine Young. I'm Assistant Director of Public Health in NHS Ayrshire and Arran, and I'm currently Chair of the Scottish Health Improvement Managers Group. So essentially we've got all the folk who are out there at the coalface trying to deliver health improvement. And we enjoy a good working relationship with Health Scotland, and that's really important as a national agency. However, I think there's one that we've not quite managed to crack yet, and that's, I suppose, whenever policy comes along or programmes, they hit your desk at the same time that they hit ours. So sometimes you're trying to assist us and develop resources and campaigns and resources. Out at the coalface, we are also, there's an expectation that we've got something ready. So I think there's something that perhaps we could do, and we've a part to play in that as well, just about how we get more in sync, so that we're not doing things in parallel to yourselves. So I suppose it's that plea to, sort of early assistance would be helpful. So I'm not sure it's a question, more of a sort of observation. And
I'll allow Margaret to respond to the observation if you want.
Well, it's also about colleagues in Scottish Government, about everybody working well together, so that when a policy is being implemented, that everybody is able to play their part. And so it does involve, that's what I mean, collaborative working takes a lot of time and effort to get it right. I can think of some examples. I think what we've done at the request of colleagues is we have our web to print approach, which means that we produce national materials, but people can take it and put their own local logo on it and perhaps a few local messages. And I know we've been doing more of that in here, and that's really welcome. So I think that's one example of the sort of thing I think you're talking about, Elaine. So I think, yeah, we're absolutely up for that, and I hope that you recognise that we're all doing our best here in that.
I think there's another example, just to draw your attention to, Elaine, which I think is one where we were able to meet that high standard of getting it right and getting the sequencing right, which I would absolutely acknowledge we don't always get. But there's been a recent piece of work done under the Scottish Public Health Network framework, and I see Neil Hamlet in the audience, around health and homelessness. And I think that was a really good example of how we worked with colleagues across public health in Scotland, bringing the evidence expertise that we could to that, and actually producing a document that really is helping to shape practice locally. So I think that's the kind of example that I hope we meet that standard more often.
If I could just briefly add to that, I think from government's perspective, we would want to see the various ends of delivery agencies working as closely together as possible, but there is also a role for government there in not allowing anybody to be surprised when something gets delivered to them. And there's probably, I think we're getting better at that, but there's a bit of maturity needed from myself and my colleagues about sharing some of the earlier thinking and direction that is taken, and actually we've been working together just in the last year or so to try to achieve that, but we need to see more of that. And the responsibility from the service users end, or the service delivery end, is that not everything we start thinking about in government is actually going to be deliverable in the end, and there needs to be a kind of system understanding of that. If we can get that, we need to share more and earlier.
Is another question from anyone? You can have questions from other than this row, incidentally.
Health and social care partnerships are just starting out. One of the challenges that we'll have at grassroots level is actually having public health very visible. With the target-driven climate that health and social care partnerships are working under, quite rightly, in terms of delayed discharges, acute bed days and all of that kind of stuff, there is a challenge for us locally to make sure that public health is visible, and it would be really great to hear Health Scotland's view on how they might support us at that local community planning partnership and health and social care partnership to make keep it on the agenda and make it visible.
Okay, thanks.
Well, absolutely, and I mean I can just think one example before I hand it over. We helped the Improvement Service produce the National Outcomes Framework for older people. What are the outcomes that Health and Social Care Partnership should be aiming for use, that outcome framework's for use for everyone, and it says things like about physical activity, eating well, things like that. So that's just one example I have in my mind. But Kath, if you want to give some more, and George as well.
Well, I'll just do it.
Just John.
Yeah. So, I mean, I think we welcome the question and we welcome the invitation. I think what we'd recognise is the different stages of maturity of that arrangement and the partnerships that have started to develop. And one of the things I think we would recognise as a national agency is our offer is one of adding value and helping to keep that visibility and keep the right things in place. And I think our commitment would be to continue to work with partnerships as they settle down and form, to make sure that we get the right focus on the right things. And I mean, I think, Minister, there'll be opportunities to discuss some of those issues a little bit later on today as well.
And I would add, not just visible, but influential.
Yes.
Because actually there's a huge amount that public health from one end of the profession to the other can bring in terms of some of the original thinking that the partnerships need to introduce as to what causes problems that they end up having to then service. So they need to be influential. That'll take time, but we need to get influential.
Sorry, we're just doing this role.
So no hands went up behind you, so you're okay.
Hi, I'm Louise MacDonald, Chief Executive at Young Scot, and many thanks also for the invitation to this public meeting. And also I think I wanted to kind of add the note around the briefing on inequalities and the work that's been done. I think from our point of view, from a third sector point of view, to see that coming from Health Scotland, that material, I think the word that escaped from my lips when I saw it was hallelujah. It was really good to have it very clearly laid out. Clearly there are challenges in that, but very welcome. But also, Margaret, your point about collaborative and preventative approach. So thinking about that, I suppose there's lots I could raise around kind of young people, but I suppose the thing that's really driving us just now is around young people and mental health, and in particular the preventative element that you focused on there, Margaret. I think, how do we, collaboratively, or where can we take bolder action in the preventative approach around young people and mental health, particularly the kind of evidence that's coming through? You may have seen the stuff that's coming out from Girl Guiding, the kind of the mental health and the pressures and the issues around young women, and so on. So it really just feels like there is a moment, I think, now where there is a need for boldness in terms of tackling this from a preventative approach. So I'd welcome some thoughts on that.
As the Minister for Mental Health, so would I. So
maybe I could kick off, and I might invite Andrew Fraser to say something on this. So Louise, thank you first of all for your comments about the briefings. Indeed, the Minister heard upstairs a bit of a presentation about our work on good mental health for all. And I think what we tried to convey to him was the extent to which the delivery of mental health services for individuals needs to sit within the context of us knowing from a public health leadership point of view the kind of other drivers for good mental health, and indeed drivers for poor mental health. I think the Girl Guiding report that I heard was a good example of the kind of pressures that we don't always recognise that then drive a particular sense, say for girls and young women, about self-esteem and about how they feel about themselves. I think that public health leadership that Sandra referred to before is really very important. But I guess my sense is that we should continue to drive our mental health improvement programmes with young people, taking account of what young people are telling us themselves. You guys have previously helped us shape some of our mental health programming, but I wonder, Andrew, whether you want to say anything around how we then translate the latest evidence into, that knowledge that we have into this, within this cycle, into the action for change and improvement.
Yes, I mean, mental health has always been a backdrop of our work, and it's been a resurgence of interest and commitment there. Our new mental health strategy, by ours I mean it's been widely owned, widely consulted amongst partners, really lays out a number of areas we can do to take action. But the theme that comes out to me in reading it is about fairness, and it really resonates with not only the conversation that we're having nationally, but the idea that it's not just about healthier but a fairer Scotland that we need to create. And by fairness I mean things like justice and social justice in a policy sense, but also fair ways in providing services. Services skewed or proportionately distributed towards people who find the most challenges in meeting and getting over the threshold to services. And that's not just health services, that's all sorts of other helping agencies. So that's what we mean to influence. But not only that, we're doing work and research in changing physical environments. I was at a meeting yesterday on regeneration and health. The mental health component, or the prize of improved mental health from improved environments, especially mental health, sings out as the major potential gain in some of these things that we're trying to do. So it's really right through what we're trying to do, but it's also lapping over into other areas such as fairness and our engagement with that conversation.
Okay. Any other questions?
Just a general part of feedback. Sorry, I'm Stuart Hay from Living Street, Scotland. Just to welcome the briefings and to say how useful they are for the voluntary sector in terms of the rigorous evidence and coming with the NHS brand in terms of justifying things and discussing things like changing speed limits to promote public health is a really useful thing to do, and I hope that work would continue and possibly also help people outside the health sector realise that they're all part of this agenda. You know, it's road engineers. It's not a technical thing. This is something genuinely valuable they're doing in changing these sort of practices.
Do you want to respond to that, Tom?
Well, just to say thank you very much. I don't know, Jeremy, you just want to explain for everyone else about why speed limits are a public health issue?
So one of the things that we try and do is pretty well tie all of the actions that we recommend that organisations take. We tie that to the evidence, and it's very clear that in terms of both pedestrian deaths and indeed pedestrian injuries, particularly with children, that the people who are most impacted by road traffic accidents are actually people who don't even use cars. What we know is that the evidence of the impact of a collision or a pedestrian being knocked over dramatically increases with speed, and therefore there's quite a tight body of evidence that shows that even at 30 miles an hour, a child hit by a car is very likely to be killed or at least very, very seriously injured. So what that also gives me the opportunity to do, Stuart, is to, I think, broaden the influence that I think Health Scotland and other public health practitioners need to have, because many of the drivers for health and well-being sit way beyond the life of the NHS. And you pointed out about road engineers, planners, people who generally design our environment have a huge role to play in terms of driving us to have quite a different lifestyle, actually making it more not only easier but actually encouraging us to have a more active lifestyle. And again, what we're trying to do is to tie the actions that we would recommend very closely to the evidence. And in that last example I gave, we know there's some excellent evidence around the impact of better green space, easily accessible green space, away from traffic on our health and well-being.
Any other questions, ladies and gentlemen? Oh.
Hi, George Valiotis. I'm the Chief Executive Officer of HIV Scotland. Thank you for inviting me today. In terms of HIV, we see inequalities as being one of the main reasons that people have a HIV risk. And we do a lot of work with human rights and the Scottish National Action Plan on Human Rights. And I wonder what the link between that action plan and the work that you have planned is.
I think Kath will answer that one.
Yeah, thank you. We're also very involved in the Scottish National Action Plan for Human Rights. Ourselves are co-convening the work on health and social care with the Health and Social Care Alliance. I agree that it's a very, very important area of work. I think the focus that we've chosen to take is on health and social care partnerships, and particularly doing all that we can to really embed a human rights-based approach into the planning and policy making at a local level. I think the early signs of that have been good. I think it's a kind of message that nobody will deny and pay attention to. Nobody will deny. I think everybody absolutely accepts that human rights are important, but I think the challenge for all of us is to make that something meaningful that changes practice. I think it's
the quality strategy is still very much what drives many of the strategic ambitions of the NHS. For us, the person-centred element of that is very important. I think a lot of what we've seen in the way that person-centred care is described, it talks about care and compassion, and nobody would deny that that's important. But I think to really get this meaningful and to make a difference to the lives of people who are most marginalised and most disadvantaged and most discriminated against, you need to get beyond that care and compassion. And of course, we're going to treat everybody the same, but actually, just by doing that, we actually leave some people out in the cold. I think we have to get much grittier about accepting that if everybody has the right to the highest sustainable standard of health, that means that we will have to treat people differently in order to achieve the same outcomes. And I think that's very much the drive of what we are trying to seek through our work in SNAP. But the more we can collaborate with others and promote those messages, the better.
Okay, I mentioned earlier we might have some questions by Twitter, which I think we do. But by video link. Not sure how that'll work. I should find out. Maybe it won't.
So this is on the theme of collaboration again. While Health Scotland's primary focus appears to be working with and through agencies, how will it ensure its strategy is directly influenced by the people its work aims to support?
Well, I'll start off with that. I mean, I think that's actually, we've been working very hard, and particularly that's one of the things that motivates us to work with third sector partners who have closer links with a wider range of people. And I could just say, you know, at the board level, one of the things that we're presently doing is seeking to have a board member who has, you know, real lived experience of deprivation and understanding of disadvantaged communities. So this is something that is very much in our minds at the moment about how we actually have that at the heart of what we do. Jerry?
So for me there are a couple of important elements of this. One of the things that we decided to do a couple of years ago was we've always had quite a strong engagement with the third sector. It's often in the past been quite tied to our focus on particular health topics. So that might be around tobacco or alcohol or mental health and a whole series of other health topics. And we decided we needed to bring a much stronger strategic focus to that. So some of the partners that we've engaged with in the last 2 or 3 years, where we've really very much tried to bring in the experience from the third sector about informing how public services need to shape themselves to respond more sensitively to need, have recognised, for example, the impact of poverty and welfare on health. And so we've worked very closely with, say, for example, the Poverty Alliance. I mentioned earlier our work around health and homelessness, and we work very closely with Shelter. Now, those organisations help bring a very different perspective to our deliberations. Not only do they make good use of the evidence that we're able to analyse ourselves, but they actually bring a different dimension to that evidence, which I think then helps us when we do translate that knowledge into action. Very specifically, though, I think there's a fantastic opportunity in front of us. You'll be aware that the government has, within the last 2 months, announced, borrowing from the experience I think that many of us believed was a very positive experience in the run-up to the referendum discussions, of a much higher level of civic engagement around what's important for Scotland's future. And so the government has recently launched 2 national conversations. Now, this is interesting because it actually comes on the back of, at last year's review, the Minister saying to us, I'd like you to be doing more work to go and have conversations with people in Scotland about what we need to do to tackle health inequalities. And so these 2 national conversations kicked off by the government are around justice, they're around fairness, and they're around what do we need to do to have a healthier Scotland. I think our work, particularly if you think about the name of our strategy, A Fairer, Healthier Scotland, puts us in a very good position to be operating between these 2 national conversations. And we've decided that our focus should be to try and engage with particular groups that find it most difficult to communicate within Civic Scotland, and most difficult, Minister, to come and have a voice with you and your government colleagues. So the kind of examples are people who are homeless, people who are travellers, gypsy travellers. They're 2 of the groups, and we are currently working with stakeholders to identify what other groups we might prioritise. So, Laura, I hope that answers the question that was posed.
I think so. There is one more if you have time. This is more about our health improvement role. The question is, health improvement work is done on the ground primarily through territorial health boards and other organisations. How is Health Scotland listening to and meeting the needs of health boards to support their delivery of the Scottish Government agenda?
Well, I'll start. So, and Andrew might want to add a bit. I mean, I think the first thing we'd recognise as national agencies, of course, this isn't a national NHS Health Scotland job to suddenly fix health inequalities and understand the roles and the direct contributions that are made locally. And there's certainly no suggestion on our part that we've got all the right answers. I mean, I think Elaine was mentioned earlier. Very often those questions are being thought about at a local level as well. So I think there's an opportunity, I think, to do more in some of our collaborative work. Certainly some of the work that we're starting to prioritise over this next period now around supporting health and social care partnerships or community planning partnerships in their broader role would be something that would work with local public health professionals. Neil's here, we talked about health and homelessness earlier. I think there's an important responsibility for us to work very closely with directors of public health, Andrew, and that might be something you'd want to add in a second. But certainly, we do I think it's the best that we can do in terms of working with local public health professionals to get to that point. But I think, there'll always be opportunities to build on that and improve on that as you go forward.
My role in the organisation is more tailored towards research and evidence, and that is primarily tailored to stakeholders such as the public health community and health improvement community in the local boards. And what we aim to do is to produce things that are of use to them, but are also known by them, and our engagement with them is partly around that and partly around professional work and creating a workforce that is effective in doing that. Another thing we can do alongside partners at local levels to create the conditions in which we can do bolder things to be effective in tackling health inequalities. And it's something we have to do together in our own and different and distinct roles.
Was that all the questions from Twitter, Laura?
It was.
Okay. I think we've got time for one last question. If anyone has a burning question they're desperate to ask. No? Okay. Well, on that basis, can I thank you all very much for coming along today. Ladies and gentlemen, we will doubtless pick up on some of these issues in the private session that we have. Also, I'd like to follow up on some of the issues in the letter that comes to the board following the review that I mentioned earlier. Can I thank the panel for taking time to ask questions? Can I in particular thank you, Margaret, for your work in chairing the board here at NHS Health Scotland for your 8 years of service and for the huge contribution you've made through that time as chair, and perhaps the audience could show their participation, their appreciation rather. Thank you very much.
Could I just say, Minister, actually in the interest of health, you could have all stood up, I could have had a standing ovation. But actually, it's just to say that there is lunch outside for everyone. Thank you.